Reform TI Pedicle Screw System Surgical Tech Guide video. Perforation of the bone cortex is accomplished with the bone awl. Cortical bone can be difficult to penetrate and requires a sharp tool to push through it. Next, the pedicle probe is used to channel a path through the cancellous core of the pedicle down to the vertebral body. There are three tools that can be used to accomplish this: a straight, curved, and duck-billed pedicle probe. The ball-tip sounder will be needed to confirm the pedicle hasn't been breached. After confirmation, select the appropriate tap based on the diameter of the pedicle. Note, all taps are 0.5 undersized in the major diameter. Attach the tap to a ratcheting T-handle or straight handle. Now advance the tap into the pedicle to the desired depth. Verify the depth using the laser markings on the tap. If using a pre-assembled screw, attach the desired ratcheting handle to the polyaxial driver and load the screw. Be sure to verify with the scrub tech that the crossbar of the driver is completely seated in the tulip. If it isn't fully seated, the driver has not properly mated with shank. If a pre-assembled screw was used, the decortication and tulip attachment steps are not required. If using a modular screw, secure a ratcheting handle to the modular driver. Set the ratcheting handle to the neutral position. Now secure the screw to the driver by twisting the silver knob counterclockwise. Once the modular screw has been placed, the decorticator is used to clear bone around the head of the shank to create space for a tulip to be attached. Decorticate by placing the bone planer over the head of the shank and twisting clockwise. Modular tulip attachment. Prepare tulips for attachment to the screw shanks by loading them on the tulip clamp. The tulip clamp has two small prongs that will engage with dimples on either side of the tulip. Once attached, the tulips can be pushed onto the shanks. After attachment and prior to disengaging, tug on the tulip to confirm it is secured into the shank. Screw adjustment. The retention bone screwdriver is then used to adjust the height of the screw. This will allow you to sink the screw further or back the screw up if tulip movement is being impeded by the anatomy. Now that the screws are at the proper height, the tulip manipulator can be used to position the tulips to receive a rod. Rod insertion. Use the flexible rod template to determine the ideal rod length and lordosis. The rod can be bent by using the French bender. There's a laser etched line that spans the length of the rod. This will help the surgeon bend the rod in the same plane across the entire rod. The rod is placed using a small rod holder or heavy-duty rod holder. Rod reduction. Use the rod pusher by applying forward pressure on the tool against the rod to seat it in the tulip. Use the rocker by sliding it into the slots on either side of the tulip. Once secured, rock the instrument against the rod to reduce it into the tulip. Use the reduction gun by aligning the slots on the reducer with the rod and placing it over the tulip. The tabs at the distal end of the gun will engage with the slots on either side of the tulip. Once secured, squeeze the handle to begin reducing the rod. Once the rod is fully reduced in the tulip, lock the handle and deliver the set screw. The reduction gun is released from the tulip by fully opening the handle of the gun. Use the reduction tower by assembling the reducer inner shaft and outer sleeve. Twist the proximal end of the outer sleeve a few times to secure the two components. Secure the tower to the tulip by sliding the two distal prongs of the reducer over the tulip of the screw. Rotate the knob clockwise to begin reducing the rod. If more leverage is needed, place the T-handle reducer on top of the tower. Once reduced, place your set screw. The tower can now be released by squeezing the tabs on either side of the tower. Lock screw insertion. Screws can be placed with either the lock screw retention driver or the double-sided lock screwdriver. Rod manipulation. In situ benders can be used to bend the rod while seated in the tulips. This allows you to change the curvature of the rod to better accommodate the anatomy or increase your lordotic angle. The rod can also be rotated with the rod gripper. Compression distraction. Further coronal alignment can be achieved by compressing and distracting. Once a level needing correction has been chosen, a set screw on the cranial or caudal tip should be tightened, then compress or distract. Lastly, tighten the other set screw. Extended tab removal. If reduction tabs were used, they will need to be removed prior to final tightening. Final tightening. Attach the torque driver to the offset ratcheting torque handle. Place the counter torque wrench over the tulip, rod, and set screw. The counter torque will protect the spine from the torque forces applied by the final tightener. Rotate the torque handle until you hear an audible click. Cross connectors. First, use the caliper to measure the distance between your rods. Next, select the desired size crosslink and secure it to the T20 cross connector retention driver. Once both arms are placed over the rod, rotate the cam on either arm to the lock position. Note the open and lock laser markings. Lastly, final tighten the center adjustment lock. This is the only lock that requires final tightening with the X connector torque handle. If attaching to an existing construct, dominoes will be required. See the surgical technique for a full list of domino options. Using an open large domino, attach one end to the existing construct and tighten the T25 set screw. Now place the second rod and secure it with a set screw. Using a close small domino start by securing it to the existing construct. Tighten using the T20 cross connector retention driver. Now place a rod for the new construct being placed, following the same steps. Use an inline domino, follow the same steps to secure the old and new construct. Lastly, final tighten using the T20 torque limiting handle.